What's going on, everyone? I want to talk about a topic that just talked to a doctor today, and this came up, so I wanted to clarify and also elaborate and give my 2 cents on how we do it and how I'd recommend doing it because I think it's the right way to do it. As far as the all or nothing approach, take it or leave it, or do we give our patients options for care? Do we meet them where they're at? Do we give them options? So let me explain. In short, we give options, but the way in which you give options is in a way to empower them and try to get them to find something within them, some inspiration to take an empowered action to do something that maybe that they didn't think they were going to want to do, which is actually transform their life and correct their spine and get healthier and move better and start getting into exercise and look at your program as the fork in the road of their ability to instead of just continuing on the same path of pivoting and doing something different that's going to have lifelong rewards. So here's how we do it. Let me just run through our day 1, 2, 3. But real quick, before I get into that, we have an upcoming event. We do this thing called the Impact Event. We haven't done one since February because of COVID. So we have our next one scheduled. It is October 16th and 17th. I put the link in the description here so you can check it out. I made a video explaining the lineup of speakers that we have, and there's a page that explains what we're going to cover in more detail, and so check it out. It's going to be an awesome event. They're always a ton of fun, and everyone that shows up, the doctors and the staff, it's just a great time, and I can't think of a better time to do it than right now, so we can actually get out of this very challenging year that we've had and transition into 2021 with some dialed in systems ready to go and ready to really best serve our communities, give our patients what they need, and give our staff the peace of mind that we're following tried and tested systems and we're not just winging it and shooting from the hip. So, do we give our patients choices? Let's talk about that. On our day 1, I think that's probably the best way to explain this, is just take you through how we do a day 1, 2, 3 process and how this has evolved. And I'll tell you, it's worked much better than when we really didn't give patients options as much. So day 1, it all starts with day 1 as far as what we're doing. Patient comes in, they're doing a tour, we do a consult, we do an exam, take x-ray in most cases, of course, and then if they're acute, we work on them, and if they're not, then we follow up on the next visit once we've analyzed all the information that we collected on day 1 to then go through with them on day 2 and get started and then figure out what camp they're in as far as options, as far as what they want to do. So day 1, I'm not going to go into a ton of detail on that, but that's like day 1 overview summary. Day 2, you're coming into the clinic. Let's say you haven't been adjusted yet. We have x-rays that we've analyzed, and we're going to go through this with you. So prior to going through the x-rays, something we've done for several years now, and we teach our Move Now doctors, is you make a broth video. BROF stands for Brief Report of Findings. That's a day 2 report of findings, not to be confused with a FROF, which is a formal report of findings, or a financial report of findings, which is day 3. This is how we've always done it in our clinic in New Mexico. This is how we did it when we transitioned, came out to Idaho. We've never done a day 1, day 2. We've always done a day 1, 2, 3. We've always done a BROF and then a FROF. Why do we do that? Because the BROF is the ability to ask the patient what they want, aka give them options. And now I'm not saying that we just say, hey, you want to come in 5 times and that's real easy, or do you want to come in this grueling process of putting all this time and energy into this, and then also it's not something where we just like automatically judge or think that we know where someone's at financially and assume that they're not going to want to put an investment in their health, but rather what it is it's just a very honest, transparent way of presenting their options in care. So what we do is on day 2, we go through, they watch a video that explains x-rays to them. Why do we do that? Because it's an automation. It helps save us time from going through the same thing that we're going to be explaining every single time, so that we can really use the time that we have with them wisely, and we can dig deeper and explain to them things about their actual care instead of spending the first 10 minutes just giving them a baseline of what normal and abnormal is and so on. So that's called a broth video. We, in our program, we have scripts as far as how we followed this, how we've made the video ourselves, how we recommend you make your unique broth video. Then we go through x-rays with them, we explain what's going on, and granted, assuming that everyone understands that the approach that we do is a corrective approach, and a big part of it is functional movement, and that's what we teach in our program is functional movement. So if you have this to offer, then you can explain it in this way that I'm going to explain right now. So you go through with your x-rays, and let's say you're finding something abnormal, you're explaining what's abnormal, you're asking them questions, you're letting them tell you based on this video they just watched, so now they are empowered to be a participant in the process instead of you just standing up and talking at them. And then from there, you basically lay out, hey, there's a couple different ways that we can go about this. One way is we can see you just a couple of visits, 3, 4, 5 times, try to get your symptom to go away, but not dig deeper, not address the structural problems that we found, not go further into a functional movement assessment and see if you have any dysfunctional movements that are likely the root cause of why your structure is broken down and you're in this acute back pain episode today, and you've had this happen to you every few months over the last couple of years. And that's an option, is we can just not address any of that, and we can just address kind of short-term pain relief. But I just want you to be very clear that we're not going to be able to fix the cause of your problem or even address it in just a couple of visits. I just want to set reasonable expectations for you. That's one option. We can do that, and we'll do a great job with you. But in contrast, that's very different than the second option, which, truth be told, that's what the majority of our patients do, is this second option that I'm about to tell you. The second option is we do what we said in option one, where we try to get you feeling better and get you out of pain and address why you came in, absolutely. But then we dig deeper. We do a movement assessment. We put together a customized game plan for you, a clinical plan that would include changing the shape of your spine, so spine remodeling, spine traction, corrective work, as well as after we do a movement assessment, we'll then have a better idea of what sort of movements could be dysfunctional, and then we will reverse engineer that process and map out a progressive exercise program to start addressing these problems, and then also, in addition, teach you what you need to be doing on your own at home so that you can continue to do these things. And then we will set goals and plan this over the course of approximately 3 months, where we then repeat and compare these same initial things that we did right now, like the movement assessment that we're about to do. In this case, because you have a really abnormal curve, and part of our goal of care in your case is going to be to reduce that excessive thoracic curve in your mid-back, we would do a comparative x-ray so we can measure that. And that would be done over the course of about 3 months. And then by that time, we would expect you to have measurable change, noticeable change, and you would have developed habits because of what you've learned in the clinic and what you've done at home. And those habits would last you for a lifetime. And in most cases, we can then begin to reduce the frequency in which we see you in the clinic, but you're left with those positive habits that we helped you build. Okay? So again, they're two totally different types of directions we can go, but I need to know how you want me to take care of you so that I can build out those recommendations for you in preparation for your next visit, which is where we'll sit down and go through it in detail if that's the route you want to go. Now, in most cases, when we're explaining this to a patient, most cases, I don't even get a chance to finish the explanation on option B, and people are saying, yeah, I want to fix it. Oh yeah, I want to do that. Every once in a while, people say they want to do option A. Yeah, I'm really not interested in that. And then we ask some questions. We find out, why, do you have a bad experience in the past? Is it a time thing? For what reason? What else have you tried? And some of those people will kind of talk themselves into why they should make this a priority, and they should adjust their actions accordingly so that they can prevent this long-term problem and actually get it fixed. And they talk themselves into coming around, and then other people legitimately just have hurdles in their life at that moment that are just not going to work. Like, they have a sick family member that they're caretaking for, and literally they have no help, and they can only leave like a couple hours per week. There's just no way they can come in at the frequency needed. In those types of cases, we meet someone where they're at, we figure out how to work with them, but we definitely map out a home protocol for them as well. So in the Move Now program, we have a home mobility kit. It's part of the program. All of our patients get a home mobility kit. Why do they get it? Because they need the tools at home to replicate the things that they're learning in office for their home care. So a patient that can't do the standard in-office phase 1 of care needed, if they're a moderate to severe adult, that's a category that we would put them in if they indeed were that. And again, we talk about this in detail inside of our program. If that's the case, if they just absolutely could not do the care needed, then they would still get their home care. They would still come into the clinic, still get direction and guidance in the clinic, but maybe do it at a lesser frequency and maybe set a longer term goal as far as when we're going to do any sort of comparative findings. Because it's going to take longer to see the change if they're not going to be coming in as frequently. And without that guidance consistently, at least a couple times a week for several weeks, then what's going to happen is, in all likelihood, they're probably just going to progress slower. So that's okay, because option C is do nothing, right? And it's not super common that we have people do nothing. Every once in a while you got someone that just wants to come in 3 times and they'll come in every time it hurts, okay? And that's the small percentage of, no matter what you put in front of them, no matter how you educate them, it's not going to change, and you have to be okay with that. The goal is not to, change everyone's mind and convert everyone over to this way of thinking. The goal is to make sure that you've done your due diligence and do an appropriate job educating the patient, understanding where they're at psychologically, from a emotional standpoint, like what is it that's driving them, and then really trying to speak to that and understand the human communication piece of that. People make decisions based off emotion and they back it up with fact. There's a lot of smart people that have said that over and over and over again. They make decisions based off emotion, they back it up with fact. So if you are this rigid person that says, I refuse to learn any of this stuff because I just want to be a doctor and I think that is bad, and well, then there's a lot of people that you could have had the opportunity to help them change their life, and it's not going to happen, unfortunately, because you're just going to be stubborn and you're going to refuse to learn how to speak to them. I mean, that's just it. So you have to learn communication to be good at this. I think someone's coming, weed whacking our grass over there, so I'm going to move. But anyway, so that's how we give our patient choices. So hopefully I summarized that so you have an idea that it's not an all or nothing. It's not a take it or leave it. We definitely work with our patients. We definitely meet them where they're at. And but in most cases, because of the way that it's presented and because it's transparent and honest and ethical and true and right, typically want to commit to care. So it works very, very well because it's a great system and it's not a bunch of rah, but there's a ton. We back up the substance by producing, by getting our patients results, giving them great resources, giving them a great experience, showing them that this is unique and different than anything that they've ever done before, and it truly is. And that's what we put together and we share with other chiropractors inside of the Move Now program. And this coming October 16, 17, we're doing an impact event. So you should check it out. This is actually the first time that we're opening up to non-members to come out to the impact event. So you can actually buy a ticket and come out to the impact event. And that's it. You can just meet us and not be part of the program, but just learn a ton. We have some great speakers coming out as well. You're welcome to do that. And then if you end up joining the program, there's something we're going to do this time where we're going to basically credit whatever you've invested in the seminar, in the impact event, towards your tuition of our program. And if you're already part of the program, which a lot of people watching this probably are, our programming have a ticket that you haven't used, it's probably already comped. But we do recommend that when you come out to this, bring one of your staff, or if it's a husband and wife team, by all means, bring your spouse. But bringing one of your staff, like exercise therapists or an office manager, or if you're just like a 2-staff setup, with you and someone else, bring your other staff person. If you absolutely can't, come solo, but it's great to be able to bring a team member so they can see the vision. And that's part of the experience of coming out to the clinic, is you see it in action. and you can then visualize and envision how you're going to do this in your own practice. And it just helps fast track this whole thing and helps you complete your vision for you. So anyway, hope that helps. Have a great day, everyone. Check out the link that I put in the description above, and we'll see you soon.